Our next presenter is Ms. Delani Mendes from Australian Catholic University, discussing the size and symmetry of the hip abductor muscles in elite Australian Football League players during the season.
First of all, I would like to acknowledge the contribution of my co-authors on whose behalf I'm presenting this work. So as you may know, according to the AFL injury report, there's a high incidence and prevalence of lower limb injuries in AFL. The hip abductor muscles, such as the gluteus medius and gluteus minimus muscles, provide lateral, pelvic and hip joint stability, and they're important for high-level function in sports such as AFL. Now, muscle asymmetry can develop between the dominant and non-dominant sides due to the repetitive nature of activity in certain sports. Previous research has suggested that there may be a relationship between injury and muscle asymmetry. However, to date, no one has investigated this for the hip abductor muscles in AFL players. So the aim of this research was to investigate the size and symmetry of the hip abductor muscles and look at the relationship to lower limb injury across a playing season. We recruited 46 elite AFL players from a professional football club, and we examined them with MRI at the start and at the end of the playing season. Muscle cross-sectional area of the individual hip abductor muscles was measured from scans taken from their lumbopelvic region. And these muscles included the gluteus minimus, gluteus medius, and upper gluteus maximus. Lower limb injury data was collected from club records kept during the season, and players with a lower limb injury were compared to players without an injury during the season. So what did we find? Results of a repeated measures ANOVA indicated a significant main effect for time for all muscles. So as you can see on this graph, the mean cross-sectional area is on the y-axis and the hip abductor muscles are on the x-axis. And as you can see, there is a significant increase in size by the end of the season for all the hip abductor muscles. However, for the gluteus minimus muscle, there was a significant difference between sides across time. This graph shows the mean cross-sectional area of the gluteus minimus muscle on the dominant kicking leg compared to the non-dominant support leg at the start and at the end of the season. And as you can see by the red bars, it increases in size on the support leg by the end of the season. With regards to the effects of lower limb injury on hip abductor muscle size, there was no significant difference between groups for all the muscles. Now, AFL involves repetitive unilateral and bilateral activities such as running, jumping and kicking, all of which require good lateral pelvic stability. So this may explain the increase in hip abductor muscle size seen in these AFL players. However, for the gluteus minimus muscle, there seems to be a different response. That increased in size on the support leg by the end of the season. Previous research has shown that the gluteus minimus muscle is recruited more than the gluteus medius muscle in single leg stance activity, and that it has a role in femoral head stability in the hip joint. So this may explain the response of this muscle in these players, because single leg stance activity is required for kicking. Interestingly, there was no relationship between muscle size, asymmetry and lower limb injury during the season. Now, previous research has indicated that muscle atrophy can occur with joint injury due to reflex inhibition of muscle activity. However, in this sample of players, perhaps due to the increased physical demands of playing football, perhaps they continued to use their hip abductor muscles even with injury, and maybe this is why we didn't see a difference. However, bear in mind that this study only looked at hip abductor muscle size and the relationship to injury, and future studies should look at hip abductor muscle function, including neuromotor control and activity, and also look at the size and function of all the muscles in the hip and lumbopelvic region to see if there are any changes with injury. So in conclusion, hip abductor muscle size increases across a playing season with asymmetry developing in the deeper hip muscles. Now, these changes in muscle size may reflect an adaptation to the functional demands of playing football and may be influenced by the muscle's specific functional role. So exercises to train these muscles should consider their roles in sports-specific functional tasks. I would like to thank the Brisbane Lions Football Club for their funding of this project and the UQ Centre for Advanced Imaging. Thank you.